Hi, my name is Jaden Maneri, and this is Walter, and today I'm going to be going over vital signs. There are 8 different vital signs that you can take on a horse. Starting at the face, you can take mucous membranes, papillary refill, pulse, skin tuger, heart rate, respiration, gut sounds, and then temperature. For vital signs, there is more to it than just he's scratching. There is more to it than just the 8 different things that you can take on the horse. You also have their normal behavior, the way they keep their stall, and how they normally act. Walter loves to scratch his butt on the cross ties, which is what he is trying to do right now. And so that's why I'm moving him over. For Walter, I know that he kind of likes to poop in the far back corner. I know that he normally pees in the middle of his stall. I know it's not normal if he doesn't have pee in his stall, or if there's not a decent amount of poop. I'm gonna let him scratch his butt. I have my eye on him, so I'm aware of what he's doing and he's not gonna get caught. But being able to know these things when you go in a stall and you don't see that there's normally pee where there should be, then you know that something's wrong, and then maybe you start taking vital signs or you keep a closer eye on him. I know that he is super affectionate and he loves attention, so if he doesn't have his head sticking out and he's looking kind of droopy in the corner of his stall, I'm going to be a little curious as to why he's acting that way and maybe keep a closer eye on him. It's also important to know the way that your horse reacts to taking vital signs or certain things going on. I know that he is pretty bomb-proof, and so the noises that are going around aren't really going to bother him, but for a different horse like Calvin, he's a little more sensitive, so I just want to be more aware when I'm around him. I always want to be aware around horses, but I know that Calvin's going to react a little bit more than Walter is going to. I also want to make sure that some horses, when you take their temperature, they kind of suck in their butt and they're a little more sensitive to it, so you have to prepare them a little bit more for putting the thermometer in their rectum. And so you just want to be aware of these things so that your horses can have the best possible experience when doing vital signs, and so you also know when something's wrong, when something's not right. For example, you also want to be aware of the way your horse eats. So if they're normally a grazer and they eat throughout the day, if they like to shove their hay into all the corners of their stall and then munch around, you need to know these things because, for example, if Walter hasn't eaten all of his hay, that's not a big concern because he likes to eat throughout the day. But say if Stevie has hay left, I know that she loves to gobble her hay down, so I'm going to be a little bit more concerned as to why she hasn't eaten her hay yet. And all of these things help to give us a good read on the horse and keep us so that we can keep them as safe as humanly possible and know when something's wrong so that they can get the best care that they need as quickly as possible. I'm going to be taking Walter's temperature. The normal temperature range is 99.5 to 101.5. Anything above 101.5 is going to indicate a fever, and it could indicate that something else is wrong as well. You want to make sure that you have a baseline temperature for your horse because every horse varies a little bit. Walter normally runs a little bit hotter, and you want to make sure you know that because then if it is a different temperature than their baseline, it could indicate that something's wrong. For their temperature, I have a kit right here. I'm going to open up. I have a thermometer. It's a digital thermometer. I'm going to clean it before I use it. You can use chlorhexidine, which is what I'm using, or you can also use rubbing alcohol. So I'm going to take a swab and I'm just going to rub it on the thermometer to make sure that it's clean. I'm going to set this off to the side. you want to take Vaseline and you're going to take your finger. You do not want to stick the thermometer directly in the Vaseline, one, because that's a little bit unsanitary, and two, because you don't want to get too much Vaseline on there. It's just enough so that it goes into their rectum a little bit smoother, and you're just going to rub it on the end, like so. And then I'm going to come around. We take the temperature rectally for horses. I'm going to make sure he knows that I'm here. I'm going to turn the thermometer on. And then I'm going to pull his tail back and insert it about 2 to 3 inches slightly upwards. Good boy. And then I'm going to wait for it to beep. And then I will know that the temperature is ready to be read. Sometimes it can take a little longer. The thermometer has been resting at 99.1. Oh, there we go. There's the beep. Perfect. So the temperature reads 99.1. Now that I'm done with it, I'm gonna turn it off. Come over, and I'm gonna take the chlorhexidine again and wipe it off because we wanna make sure that it's disinfected before we put it in another horse. Another type of thermometer that you can use is called a mercury thermometer. So for that, you're gonna wanna shake it until it's down to 98 degrees, and then you will insert it the same way. Put Vaseline on beforehand, disinfect it as well. Then put Vaseline on, you'll stick it in the rectum, about 2 to 3 inches, slightly upward. And then normally those will come with a, like a clip that you can hook onto the tail so that then you can leave it in. You'll leave it in for about 2 minutes and then it'll be ready for you to check the temperature. You do want to be careful with these because sometimes you can leave them in or the horse can like suck the thermometer in to their rectum, which is never good. So you still want to be present and watching the horse, but it just makes it so it's a little more hands-free. The digital thermometer just gives you a little bit of a quicker answer and a little bit more accurate than a mercury thermometer. I'm going to be taking Walter's heart rate now. You want the heart rate to range between 30 to 42 beats per minute. For the heart rate, you're going to come right on the left side and you're going to go right over the heart girth. You're going to put the stethoscope in your ears. You're going to tap lightly to make sure that you can hear and that it's working. And then you're going to apply the stethoscope and listen. And it can be a little bit tricky to find the heart rate, so you might have to move the stethoscope around a couple different like around this general area to be able to find it. Found it. When you are timing for the heart rate, normally when you're trying to get a baseline heart rate or pulse or anything like that, respiration rate, you're gonna want to do 30 seconds and then multiply by 2 so you get their average beats per minute. Since for time's sake I'm gonna do 15 seconds today, this is totally manageable and it gives you an accurate number. It's just you want to have more time to listen when you're getting that baseline, but since we're not trying to do that today, 15 seconds will work just fine. So I'm going to find the heart rate again. Found it. And then I'm going to press start on my timer. Oh my gosh. Okay, done. So I got 9 beats per minute, I got 9 beats in the 15 seconds. So then I'm gonna multiply that by 4. I do know what that is without using the calculator, but it's 36 beats per minute. This is within the normal range because the normal range is 30 to 42 beats per minute. Now I'm gonna take Walter's respiratory rate. The normal respiratory rate is 12 to 20 breaths per minute. I'm gonna do this the same way where I time for 15 seconds and then I multiply by 4. For respiratory rate, you want to take into consideration what the horse has been doing recently, because if they've been exercising or if they're kind of stressed out, then that's going to affect their respiratory rate. You don't want what's called, oh my goodness, you don't want what's called an inverted respiration rate. So that is when your respiration rate is higher than your heart rate. That could indicate that there's something serious going on. So to take the respiration, you're just going to watch the flank for 15 seconds. So I'm going to watch as he takes 1 breath, and then I'm going to start the timer. Okay, so I got about 3. Now this I got about 2. 2 times 4 is 8. Normally that would be on the lower side because it's 12 to 20, but Walter is a more in shape horse, so he's gonna have a lower respiratory rate. If they're a little bit heftier and they haven't been working a whole lot, they're gonna be on the higher side. And he's just resting right now, so he's not under any stress. He's very relaxed. Now I'm going to be doing capillary refill. For capillary refill, you're going to lift up the muzzle and blanch the gum on the top. So blanching is when you press your finger down. You're going to wait for the color to kind of disappear around, and then you're going to lift your finger and watch as the color goes back into his gum. Now you want the color to return within 1 to 2 seconds, or that could indicate dehydration or poor circulation. So I'm gonna lift up his gum like so. I'm gonna take my finger, blanch, and then let go and watch as the color comes back in. His came back pretty fast, so he's good to go. Now I'm gonna be doing mucous membranes. There are 2 places that you can test for mucous membranes. So you can do under the muzzle on the gum, and you're gonna lift them up and you're gonna look and feel to make sure that they're pink and moist, which his are. You can also do it in the conjunctiva of the eye, but it is a little more, it's harder to do this, and some horses, Walter's being very patient with me, but a lot of horses don't like doing it there, so we just leave it be. And the gum is a really easy place to do it. So as I said before, you want them to be pink and moist. If they're like a fiery red color, it could indicate fever or infection. If they are a brick red, bluish, purplish color, that could indicate lack of oxygen. If they're yellow, that could indicate jaundice or liver failure. If they're pale or like have a whitish tint to them, that could indicate anemia or shock. And then if they're dry, that could indicate a fever as well, or dehydration. You can also find a digital pulse. So that's going to be located right around here. A digital pulse is going to indicate that there could be some like inflammation or something wrong with the hoof if it's bounding. Sometimes on certain horses you can feel like a very faint digital pulse, but you don't want a big bounding pulse because that can indicate that there's something wrong. You also don't want there to be a lot of heat down here. That is also an indication that something is wrong. Now I'm going to be taking gut sounds. The normal gut sounds are going to be intermittent gurgling, so like on and off grumblings kind of the stomach. This is called orgamous sounds. I have to say it slowly. If there's like a running water sound, this could indicate hypermotile or that the stomach is overactive, which is not good. If there's a pinging sound, that could indicate a gas colic. And then if there's no sound, that could indicate an impaction. So to listen for gut sounds, you're gonna listen in all 4 quadrants. You have the upper left, upper right, and then lower right and lower left. So you're gonna listen for about 10 seconds, and you're just gonna rest your ear. You're gonna make sure that they know you're up here, not up here, but that you're here. And you're just gonna rest your ear. I can hear gut sounds. I'm gonna go down here. When I'm listening in the lower quadrants, I'm gonna be aware of his hind legs because I don't want him to accidentally get freaked out by something and he kicks and then I'm in the way of his foot. And I can hear gut sounds, so he is good to go. I'm gonna be taking Walter's pulse now. So the pulse is gonna be the same as the heart rate, which is 30 to 42 beats per minute. Where you can take this, you can take it under the jaw in the with the maxillary artery. So you're gonna reach with your 2 fingers underneath here, like so, and you're gonna feel around for it. It's gonna feel kind of like a wiggly worm, kind of slimy. It's gonna try and jump out of your fingers, but you're just gonna lightly press down. If you're unable to feel it, you might be pressing too hard, so loosen up your touch a little bit. And then you might have to walk with the horse as you take the pulse, and that's totally normal and okay. So for this, I'm also gonna do 15 seconds. So I'm going to apply, I'm gonna listen, or not listen, but I'm gonna feel. Oh, thank you. Hey, you're okay. I know, good boy. I'm gonna feel it. I'm gonna wait till he stops chewing. Found it. I'm gonna start my timer. Perfect. I got 9. So then I'm gonna multiply that by 4 and that gets me 36, which was the same as his heart rate. So he is good to go. Another place that you can take the pulse is the transverse facial artery. You can also, you can't take the pulse here. Actually, can we pause? I'm gonna be doing the skin trigger test now. So to do this, I'm going to tint the skin so that it lifts up like this, and then I'm gonna let go and watch it fall back. I'm gonna count to make sure it falls back down within 1 to 2 seconds. If it doesn't, then that could indicate dehydration. Walter is an older horse, and sometimes older horses can have flappier skin, so it might take a little bit longer for them to go down. It's just a good thing to note. So how you know where to pinch and tint the skin is you're gonna do it within the triangle. So the up here is the nuchal ligament, you have the scapula, and then you have the cervical vertebrae. You want to do it inside here, and you're just going to pinch the skin like so, let it go, 1 Mississippi, 2 Mississippi, and you're going to count like that. His is perfectly normal, which is good.